Welcome and thank you for attending the second of our three-part webinar series, Understanding ICD-10, Where Are We Now and Where Are We Headed? Today we will discuss the effect that ICD-10 will have on the provider practice. Our first webinar last month, we discussed kind of a basic level understanding of ICD-10, and we will provide a review for those of you that have not seen the part one of our webinar series. Just as a reminder, this webinar series does qualify you to obtain 5 CEUs. You will need to attend or view all 3 of the webinars in the series to qualify, and we will have more instructions on receiving the CEUs at the end of our webinar series in December. We will have a question and answer session available at the end of this webinar as well. I just wanted to flash the webinar schedule up here. We do have a recording available for the first webinar, again providing a basic understanding of ICD-10, and that is available on YouTube, keyword Avisena ICD-10 webinar. So today we'll discuss ICD-10 and the effect that the transition will have on the provider practice, and then we're going to wrap up the webinar series in early December when we further define the implementation process and discuss the Avisena services available to help with this transition. Here's the review that I spoke of for our first webinar, where we went over a basic level understanding of ICD-10. The compliance deadline, October 1st, 2013, and as Wendy has stressed and will continue to stress, this is a hard date. We are not expecting any grace periods. There are no grace periods for the compliance deadline. We're seeing the diagnostic code set expand from about 14,000 currently with ICD-9 to over 69,000 as we transition to ICD-10. We're seeing the code structure itself expand from about 3 to 5 characters up to 3 to 7 characters. So with that comes a greater need for specificity in documenting our patient visits. And because of all of this, training and education is going to be required at all levels, from providers to medical assistants to billers, so that we can expect and anticipate a smooth transition to ICD-10. So the topics for today's webinar will be: what will change in the provider practice with ICD-10? What can practices do to start preparing? Where do we start? What's coming next? And then finally, we're going to look at the implementation timeline that we showed in the first webinar, and we're going to look at some of those critical deadlines along the way to the compliance deadline of October 1st, 2013. At this time, I'd like to welcome Wendy Frierson. She is Avisena's Director of Compliance and Education. She is an AHIMA certified ICD-10 trainer. Welcome, Wendy.
Good afternoon and welcome. During the first webinar, we discussed there's no such thing as business as normal as it relates to ICD-10. Today's discussion will be from the perspective of the day-to-day operations process flow in a provider setting. What will change with ICD-10? There will be slowdowns in the patient's flows and the staff's productivity as we approach the go-live date. It is recommended that all benefits verifications are performed 48 hours in advance. You may encounter some complete system changes that may also affect your productivity. Make sure you're following the HIPAA mandated guidelines. The super bill, there will be no such thing as a single page super bill for ICD-10. We're anticipating about 10 or more pages for a single encounter under the ICD-10 structure. An electronic super bill is highly recommended. There will be a new ABN effective January 2012 with changes to accommodate ICD-10. Some patients' coverage may change. This will be dependent on the carrier. Anticipate a few snags during the first couple of weeks. There will be some frustrations, however, it does get better. The office manager's role will change drastically. New policies and procedures will be required for ICD-10, as well as new reports and other functionalities under the 5010 conversion effective January 2012. ICD-10 may have an impact on your current vendors and payer contracts. Start to prepare an ICD-10 budget to accomplish all that's required for a successful ICD-10 transition. Schedule more time for tasks, even if it means not packing your patient's schedule, at least a few weeks prior to the go-live date. Schedule more staff if needed to accommodate the slowdowns and the extra time that may be required to get through your normal day-to-day processes. Acknowledge frustrations. Managers, be ready to diffuse tension, think positive, schedule a reward for a job well done. Revise as needed. If something's not working, fix it. You have 22 months to perfect it. The gains made in the proficiency will make up for the temporary decline in revenue. The referral process is time-consuming under the current ICD-9 coding structure. You will require additional resources for ICD-10 to avoid the backlogs with the referrals and the authorizations. Start to make adjustments to any paper forms that may need to change in order to support the ICD-10 coding structure. For example, your super bills, your labs, your test requisitions, any inter-office forms. Payers should provide you with any payer-specific forms that may require changes. Once the confusion begins to clear and the new paperwork and processes appear to be working well, formalize a operational procedural manual and use it as a guide. Yes, change is here, so let's embrace it. Billers and coders will require extensive training on the new ICD-10 code set and a refresher course in medical terminology and anatomy. Remember, payers will be denying claims based on unsupported ICD-10 codes. Also, coders will be required to use ICD-9 and ICD-10 concurrently for a few years. For an example, for denials, appeals, and resubmissions prior to October 1st, 2013, all codes will be reported under the ICD-9 coding structure. Dates of services October 1, 2013 going forward would be reported under the ICD-10 coding structure. So remember, coders will be required to have extensive training in order to be proficient in ICD-10. Avisena Institute will be offering ICD-10 courses starting January 2012. Providers' documentation specificity will need to increase. Providers will require training on the new code sets. Remember, we're going from 14,000 to 69,000 ICD-10 codes. If the physicians do not properly code their patients' encounters, revenue will drop and the rest of the practice cannot function effectively. Remember, ICD-10 codes will be used for all clinical areas. Physicians will need training on ICD-10. The sooner, the better. A closer look at the provider's impact as it relates to ICD-10. Documentation of diagnoses and procedures. Codes must be supported by medical documentation. ICD-10 CM codes are more specific. ICD-10 requires more documentation to support codes. Expect a 15% increase in documentation time per the AAPC. Revenue will be impacted if codes are not coded to the highest specificity, which will result in denials and/or additional documentation requests from the payers. Coverage and payment. New coding system will mean new coverage policies, new medical review edits, and a new reimbursement schedule. The relationship with plans. Changes will be based on the new codes. Your coverage and reimbursement may be impacted by ICD-10. A closer look at the provider's impact. Billing and eligibility transactions. Updated transactions to support the ICD-10 codes. New codes means more specificity. How smooth would this transition be? Expect an increase of rejections, denials, and pens as both plans and providers become familiar with the new code sets. Laboratories and pharmacy will need to be specific in the ICD-10 codes that are selected when ordering labs. Expect coverage changes due to ICD-10. Quality measures and pay-for-performance may also be impacted by ICD-10. Contact each of your insurance company and ask about their readiness for 5010 and ICD-10. Make sure your payers have updated software. They're able to map from ICD-9 to ICD-10. You also would want to ask, when can you start testing? Avisena is actively testing with each of their payers to ensure that we've worked out all the glitches prior to the go-live date of January 2012. What can a practice do to prepare? Organize the implementation efforts, develop an ICD-10 communication plan, conduct impact analysis, organize cross-functional efforts, develop a budget, internal designs and system development, develop a comprehensive training plan, contact your system vendors, look at your implementation planning, Phase 1 training, your business processes and your analysis, Phase 2 education and training, which is very important, policy changes and development, look at your outcome measures, and be ready to go live on the implementation compliance date. Despite CMS history of moving implementation dates, everything indicates that ICD-10 will move forward as planned. Where do you start? Assess all of your staff members' training needs. Hire a consulting company if this is not within your scope. Develop a comprehensive training curriculum aligned with the industry timeline to ensure staff proficiency. Budget for time and costs related to ICD-10 implementation, including expenses for system changes, resource materials, training, and additional staff. Conduct test transactions using the 5010 version with your payers and clearinghouses. Avisena is handling the testing of the 5010 and the ICD-10 code set as it relates to our platform. What is being communicated to healthcare providers? Identify your current systems and work process that are used under the ICD-9 code sets. Talk to your practice management system vendors about accommodations for both versions 5010 and the ICD-10 code set. Discuss implementation plan with your clearinghouse, billing services, and payers to ensure a smooth transition. Talk with your payers about how ICD-10 implementation may affect your contracts. Identify potential changes to your workflow and your business processes. Look at areas where delays may potentially affect your implementation process, such as new forms, new processes, slowed operations. There will be a lag time as the staff becomes acclimated with the new changes. What's next? Retraining. Staff coders will need to be retrained using the ICD-10 code sets. Providers would need training in the area of improved documentation. Billers would need to have knowledge of ICD-10 code sets to ensure that the claims are being submitted with the appropriate ICD-10 codes to alleviate coding denials. New manuals. All providers would be required to purchase new ICD-10 manuals dated 2013. Update your software. Providers will need to update software to accommodate the 5010 changes as well as the ICD-10 code sets. Hire certified coders. Providers may want to hire certified coders to assist with the transition of the new ICD-10 code sets. Invest in your current staff. Avisena Institute offers the CPC course as well as the ICD-10 coding course. Both courses are approved by the AAPC and AHIMA. Again, Avisena Institute will offer the CPC course and the ICD-10 coding course beginning January 2012. What's next? Update your carriers, policies, and procedures. Update your coding and denials appeals process to ensure that you're compliant and your ICD-10 ready. Update superbills. If the practice is using a superbill that contains ICD-9 codes, these codes should be replaced with the appropriate ICD-10 codes. Continue to fight fraud and abuse and any upcoding and downcoding issues. Code appropriately. Do not downcode due to fear. The key to the successful use and transition to ICD-10 is going to ensure the providers are aware of their responsibility towards better documentation of their patient's medical condition. We have 23 months to the seamless transition from ICD-9 to ICD-10, so let's get started. This slide indicates the timeline for a successful implementation of ICD-10. This is not set in stone, however, it may be used as a guide to assist with the implementation process. Again, if you're not on board, it's time to get on board. I will now turn this back over to Jeremy.
Okay, thank you, Wendy. On this slide, we've added some resources for those that would like to find a little more information on ICD-10. We've added some resources on CMS from the World Health Organization, as well as the link to the Avisena Institute, which will be a resource available for coding certification programs. And we will dive more into the Avisena Institute in the last webinar in December. So at this point in time, we have reached the Q&A section. So the first question to Wendy is, what's going to happen with the superbill for ICD-10?
It is recommended that the superbill be migrated into an electronic version. Because of the size of the code sets for ICD-10, it's highly impossible to use a paper superbill under the new code structure.
The next question is it required that everyone take a refresher course in anatomy and medical terminology?
Yes, it is highly recommended that everyone takes a medical terminology and an anatomy course because of the involvement of ICD-10.
Okay. The next question is, how much training is required for a non-coder?
The amount of training for a non-coder would be anywhere from 14 to 16 weeks, including anatomy and medical terminology.
Our next question is, are we expecting more changes in the field of, say, obstetrics opposed to other specialties? In other words, to rephrase that, are certain specialties going to be impacted more in terms of the number of changes than other specialties?
Yes, obstetrics being one, the musculoskeletal system being two. Those areas will be highly impacted under the new coding system of ICD-10.
Our next question is, what is Avisena doing to help provider practices during this transition?
Avisena will be hosting ICD-10 webinars up until the go-live date. Avisena will also have subject matter experts to assist practices with the implementation of ICD-10 as an additional service. We will also be hosting coding courses at Avisena Institute.
And our last question for today is, how would you begin to budget for ICD-10?
Budgeting for ICD-10. You will start by performing your initial assessment, which will look at all of your business areas, your IT systems, your training, your process flows, your outcome measures. You're going to take all of this information, and based on the outcome, then you will develop a budget for ICD-10.
And this concludes our webinar on the effect of ICD-10 on the provider practices. Again, this was webinar 2 of 3. Our last webinar in the series is Friday, December 2nd, where we will take an even closer look at the implementation process and again further discuss some of the services Avisena will have available for our practices. We want to thank you for attending. And just a note that all of the webinars will be available on YouTube, available for our practices, with keyword search Avisena webinar ICD-10. Again, thank you to Wendy, and thank you all for listening. Until next time.